To kickstart our discussion here, according to the American Thyroid Association, an estimated 20 million Americans have some form of thyroid disease, and 60% of those folks are unaware they have a problem. Furthermore, women are more likely than men to have an issue. 1 in 8 women will develop a thyroid disorder during her lifetime. These are pretty staggering statistics, so we wanted to call in a top expert to address it with us. Thanks so much for joining us today, Dr. Romm. Welcome to the show.
Total pleasure. Thank you. And those, as you were reading those statistics, every time I hear them, the word that comes to my mind is also staggering. It's just, really? That's a lot.
It is. It's shocking,
huge.
Actually, how many patients that we treat in our clinics that have thyroid disorders. So I wanted to lead off the question today with, why is it that we're seeing a high prevalence of thyroid disorders?
Well, it's not just that we're seeing a high prevalence of thyroid disorders, we're seeing a high prevalence of chronic disease in general, and we're seeing a high prevalence of all endocrine, or in other words, hormone problems in women particularly, largely because our systems are a little bit more keyed into what's going in our hormones. And so the bigger question is, why are we having all this chronic disease? Why are we having all these endocrine problems? And that kind of dials into how we think about our health, right? Do we think about our health as just, oh, I wake up today and I have a thyroid problem, or I wake up today and I have diabetes, or I wake up today and I have endometriosis? No, it's a constellation of complex factors that add together. So it's our diet, it's our modern American diet, or as it's ironically called, the SAD, or standard American diet. It is the 80,000 some odd environmental toxins that are in our homes, in our water, in our food, in our air, that our grandmothers and great grandmothers literally weren't exposed to because they didn't exist. It's the chronic, unrelenting stress that we're under. Mm-hmm. And then it's not just the things that we are getting, like environmental toxin exposure, it's the things that we're not getting. So it's not just that we're getting junk food and getting exposed to plastics left and right and stress. It's that we're also often depleted or deficient in the very nutrients and the sleep and the relaxation that we need that counterbalance that kind of overload that we're getting. And when you add it all together, it affects our health. And then our hormones are so exquisitely sensitive. I mean, if you think about it, it's like, if you imagine like one teardrop in an Olympic-sized swimming pool, that's sort of a rough equivalent, and probably even a little bit more than the amount of hormone that it takes to establish your menstrual cycle, or for your thyroid hormones to work. So tiny little disruptions can add up. And what we see is a lot of disruption in women's thyroid health.
Yes, I love that you're focusing on all those things. I think it's so important because it is so multifactorial. And so bringing that to light is important, because I think there's so many people who are just diagnosed and don't really even understand why they have a thyroid condition.
Exactly. It also explains why medication, while it can be a solution to symptoms or to providing something, like if your thyroid stops working and you need thyroid hormone, then the medication can become a really important part of feeling better. Mm-hmm. But just doing the medication doesn't solve the problem. And just waiting, I mean, like you said, Drew, 1 in 8 women is going to have a thyroid problem in our lifetime. That means it's not enough to just sort of like wait and see, oh, am I one of the people who randomly gets this? But living in a healthful way so that as much as possible we can prevent those downstream consequences.